Well, I want to respect everyone's time, and I know we've got a lot of information ahead of us. So there may be some folks joining us as we get going here, but let me just start by welcoming you. This is our Cancer and Financial Health program that we've got. We've got some great speakers, and I'm really excited to be able to do this program. Let me start just by saying my name is Maureen Higgins, and I am with the Dempsey Center. I've been with them about 11 years now. Background in social work and doing community engagement now. So pretty excited about being able to offer this kind of program. For any of you who might not have connected with the Dempsey Center before, just briefly, we are there and available to folks who are impacted by cancer, no matter what that impact is, whether it's directly to you or someone that you love, and no matter where you are at in the journey. So it may be somebody who's newly diagnosed, through treatment or post-treatment, so anywhere along the cancer journey. And we offer a variety of different programs, things like nutrition counseling, nutrition classes, fitness consultation, fitness classes, yoga, tai chi, those kinds of things. We offer massage, Reiki, and acupuncture. Of course, the massage and acupuncture right now, not quite able to offer that, but we're doing some virtual programming that have to do with acupressure and some self-massage. We are able to offer counseling with licensed clinical social workers. We have support groups. We offer a variety of different educational programs like this one here. We also have youth and family programs. So again, a whole variety of different things that folks can access. Everything that we offer is at no charge to the participant. So we certainly encourage folks to be able to use anything that would be of use to you. So please feel free to do that. And you can check out any of those programs. We're at dempseycenter.org, of course, or give us a call, whatever would be most helpful. So I'm going to launch right in here. Just a couple of housekeeping things. As you come into the program, you'll notice that you're on mute. And so we ask that you stay on mute unless you have a question. But if you have a question, also feel free to use the chat function. And for those of you, if you kind of move your mouse around a little bit, you'll be able to see where the chat function is. In mine, it's down below, and you can click on that and type in. And there's a piece that comes up. And so you should be able to chat to everyone so that everybody can see the question. And that way our presenters will also see the question. We've got somebody, Linda actually is going to help moderate the chat function. And if for some reason that isn't working for you, we'll also have the opportunity where you can unmute and ask questions as well. Okay. Let's see. Yep, we'll have time both 2 and 4. So I'm going to start by introducing, just mentioning all of our speakers, and I'll give them a bigger introduction when we get to their piece of it. So we have Elizabeth Newport, who's with Social Security. We've got Tori Lavoie, who is with New England Cancer Specialists. We have Nicole Lemieux and Linda Halloran, and they are both with Town and Country Federal Credit Union. So we're really excited to be able to have all of these different speakers here. So I'm going to start out with, where did I put you? Oh, this didn't print that one. I'm going to start out with, you know what? I'm going to have you do some of your introduction here because it didn't print on my newly formed thing here. This was done a little earlier. But we have Libby Newport. She's with the Social Security Administration, and she is a public affairs specialist. And she's going to do a little bit more of her introduction here because it didn't print out on my sheet here, so I apologize for that. So Libby, I'm going to let you take it away.
Sure. I hope everybody can hear me. So yes, my name is Libby Newport. I work for the Social Security Administration. I am a public affairs specialist for all the Social Security field offices in the state of Maine, as well as for the Portsmouth, New Hampshire district. And so what my job entails is providing outreach, education, and training about all things Social Security. And I've been with the agency for about 15 years, and I enjoy sharing my knowledge with the communities that I serve.
Great, thank you.
Sure.
And I am going to share my screen here. There we go. All right, can everybody see that? Okay.
Looks good. All right, so if we want to move right to the first slide, that would be great. Okay, very good. So what I'll talk about first a little bit is Social Security, a little bit of background in Social Security and how it's funded. And so your Social Security is funded by FICA taxes, or Federal Insurance Contributions Act. And that comes from your payroll deductions. So back in the old days when we used to see paper paychecks, we would see the deductions for FICA, and that would be 7.65% total. 6.2% is for Social Security, and 1.5% is for Medicare. And those taxes help fund Social Security and Medicare benefits for those folks that are actually receiving a benefit now. So the way that it works is that my current Social Security benefits are paying for those folks like my grandmother's survivor's benefit or my father's Social Security benefits. And so it's not as if it's a savings account for you yourself, but what will happen is once you do reach the age of receiving a retirement benefit, or if you should find yourself disabled, your benefits will be paid by those who are currently working and paying those FICA taxes. The amount of your Social Security benefit is generally approximately 40% of your pre-retirement income. And to see what your personal Social Security would be, if we go to the next slide, this is a screenshot of our website where you can sign up to create a My Social Security online account. Social Security used to mail you statements showing you how much you earned every year since you started working, and it would give you benefit estimates. How much you could get once you retire, how much you could get if you found yourself disabled, how much money your dependents could receive. Because Social Security is no longer able to mail those to everybody in the United States, we offer that information directly to you right at your fingertips via online My Social Security account. And so the next slide kind of outlines the steps on how to do that. So you visit our website at socialsecurity.gov/myaccount. And you just select to sign in or to create an account if you've never done it before. It will ask you some personal information to verify your identity. And then just like any type of online forum, you select a username and password. There's security codes, and it's a great safeguard against fraud. For those people that are a little bit nervous about putting their information online these days, it's completely understandable. But to create a My Social Security account is actually the best safeguard against fraud because it's those people that have their Social Security numbers left susceptible to a hacker to create an account. You can be sure that your own Social Security account that you create legitimately is yours and will be safe from anybody trying to create a false account in your name. So now that we have a little bit of background in Social Security and how you can access your own information, I'm going to talk a little bit about disability from Social Security. So Social Security offers two types of programs that I'll talk about today that are based on disability. The medical definition for both types of programs is a person who's unable to work due to a severe medical condition or a series of conditions that has lasted or is expected to last at least 1 year or to result in death. And that person's condition would prevent him or her from doing substantial gainful employment, which I'll talk about in a little bit, which is work that he or she did in the past, and it must prevent that person from being able to adjust to other types of work. So this is kind of an umbrella term for all adults for disability for either of the programs that we'll talk about. The next slide, I'll talk about that first Social Security program, which is called Social Security Disability Insurance, or SSDI. And this is a program based on having worked and paid Social Security taxes. So kind of like at the very beginning of the presentation, when I talked about your retirement benefits and how much you could get. If you're to find yourself disabled and Social Security says that you are medically disabled, the amount that you would get would be your Social Security retirement benefit at your full retirement age. So if I today at age 39 were to file an application for disability and I was found disabled, I would then be paid the rate of disability that I could get if I were to be able to wait until my full retirement age of 67 years old. So your Social Security disability insurance benefit is unique to you and based on how much you've worked and paid into Social Security. SSDI is, again, for those who have a condition that's expected to last at least a year. You're under your full retirement age. And if you're working, you're earning less than substantial gainful activity limit. Every year, Social Security places a value on what constitutes substantial gainful activity. So for the year 2020, SGA, or substantial gainful activity, is $1,260 in earned income, so wages and or self-employment. So that's per month. So in the case that an individual visits a field office or contacts Social Security for a disability application, if that person is working and they're earning more than that substantial gainful activity limit, their claim would be denied non-medically because they're already earning above the SGA amount. Now, as long as they're either not working or their earnings are under that substantial gainful activity amount, they could then proceed to have their Social Security case referred for a medical decision. The next type of benefits on the next slide is called Supplemental Security Income, or SSI. And this is a program that is based on financial need. So it's needs-based. Unlike SSDI, in order to qualify for SSI, one needs not to have worked to qualify for the benefit. This benefit is purely based for people who either haven't worked enough or worked at all, someone who may have limited income and resources. There's no age limit, so this benefit is also available to children. So parents that may have a child who has a disabling condition, obviously the child's never had a chance to work, so they wouldn't be able to get SSDI, so perhaps they could get SSI. The total, the federal benefit rate for SSI is $783 per month. So it's not a whole lot of money, but with that SSI payment comes Medicaid eligibility, which is the state health insurance, which I'll talk about in a little bit. But the most that one can get on a monthly basis is $783 per month. The SSI benefit can fluctuate. So it could be less than $783 per month, depending on one's household income. Resources we also count. So that would be like how much money in the bank, if you have more than one vehicle, if you own a lot of property, you may not be eligible for SSI. So this is purely a financial benefit based on financial need only. So the next slide will kind of outline the differences between the two types of benefits. Again, they both have the same medical definition, but different non-medical criteria. So for SSDI, we look at payments coming from the Social Security trust funds, and they're based on someone's own earnings. Whereas SSI comes from the General Treasury Fund, not the Social Security trust funds. And SSI payments are not based on someone's earnings. SSDI is like an insurance program that you work and earn by paying your Social Security taxes, whereas SSI is a needs-based public assistance program that requires no work history. Your SSDI will pay benefits to a disabled individual who are unable to work, regardless of income and resources. So for the person who might own more than one property or own more than one vehicle or have a lot of money in the bank, they can still count on getting that SSDI check each month. Whereas with SSI, this pays people who are disabled and have limited income and resources. So we will look at means testing to see if one qualifies for SSI. So we can go to the next slide and talk a little bit about Medicare and Medicaid. So for someone who qualifies for SSDI, one will automatically be entitled to Medicare, which of course is the federal health insurance program available to people, for most people once they reach age 65. But this becomes available to somebody who's been found disabled by Social Security after 2 years of qualifying for the benefits. Medicaid, however, or in our state, Maine, we call it MaineCare, is the state health insurance program for people with low income and limited resources. So once someone becomes eligible for SSI, they are automatically eligible for the state's Medicaid program or MaineCare. So for a lot of people, even though that SSI payment of $783 isn't that high, a lot of the reason that they want to have that SSI eligibility is so that they can have that MaineCare health insurance. That's really important to them. So we can go to the next slide to talk about how one applies for disability benefits. So during times that we're not in a pandemic, we do offer in-office appointments for people to come and talk to us for face-to-face service. Of course, during COVID-19, we're taking precautions, and so our offices are closed to in-office traffic, but our offices are open on the telephone, and you can also file your application online. The nice part about filing online is that you can go online at www.socialsecurity.gov, and that's on the next slide. You can see a copy of our webpage. So if you see at the top right-hand corner, it says disability. So once you would click that, it's very user-friendly and very intuitive. And the nice thing about filing for disability online is that you can start and stop. If you're tired, you can take a break. You get a re-entry number and you can go back in a little bit later when you feel like finishing up. The disability application will ask you a lot of questions about your health condition, your work history. It will ask you about medical sources, doctors, hospitals, clinics, treatment. And so because it asks all of that, it's nice to be able to do it online so you can maybe gather some of those records and then go back in and file online. The important part to know about filing online is that it doesn't just go into outer space. It does come directly to our offices. And so a Social Security employee reviews any and all applications that come through our online channels. So we make sure that everything looks to be correct. If we have any questions, we absolutely recontact you to make sure everything looks fine and smooth. It's not your responsibility to furnish medical records directly to us. What we do is we have you electronically sign a form that will allow Social Security to obtain your medical records. So if you have a lot of medical records from Maine Medical Center or Southern Maine Medical Center, it's not your job to get all of those to us. All you need to do is sign a form and Social Security will obtain those records directly with your authorized signature. So what we do next is we send your case to Disability Determination Services in Augusta, and we can go to the next slide. So Social Security has 9 field offices that serve the state of Maine, but we have 1 Disability Determination Services office. They are in Augusta. And because we only have 1 DDS for all 9 offices, it can sometimes be a lengthy process to come back with your medical decision. For most people, it takes approximately 3 to 6 months to come back with your medical decision. There are exceptions. So depending on the type of diagnosis you have or your illness, we do sometimes have something called quick disability decision. We have a terminal illness, and we also have compassionate allowance cases. So if your diagnoses, if they meet any of those criteria, a lot of times we'll see cases come back with a decision within a week. Now, for the cases that are not awarded the first time around, we absolutely encourage people to file an appeal. And by filing an appeal, it protects your original filing date. So if I were to file today, October 5th, and in December I was denied, if I filed my appeal within 2 months of that denial letter, I would protect that original October date. So if later on, when my case comes back with an appeal, if that decision is overturned, I would still get benefits going back to October. However, if I got that denial in December and I waited, beyond 60 days, if I waited until sometime in March to file my appeal, that appeal denial would be denied, and then I would just have to start all over again. So it can be discouraging to be denied initially, even a second time, but I would strongly encourage you to pursue those appeal rights, because that can absolutely help you and get you some retroactive benefits if that appeal is overturned later on down the road. So that concludes the formal part of my presentation. I don't know if we'd like to stop and see if there are any questions.
I have a question if there aren't any other ones right now.
Sure.
So when somebody is on the compassionate care list and applies for Social Security disability,
yep,
and they get approved and they get that benefit, and
yep,
then say they're in treatment for a year and deemed in remission, and they go back to work. So then they lose their disability income, which is obvious, and then they start getting their gainful employment income. Why would Medicare health insurance still kick in at that 2-year mark, that 24-month period, even though they're back to work? Why would that kick in?
That's a good question. And actually, if somebody is in remission and they do return to work, Social Security benefits do not automatically stop. We actually have work incentive programs that allow for individuals to test their ability to return to work. So,
yes.
So there is a period of time during which they might be working and earning and exceeding that substantial gainful activity limit where they're still getting their Social Security benefits. But because of that, they still have their Medicare. Okay. So we want to be able to allow people to test their ability to work, but we understand that it might not. There might be some people that they go back to work, they thought that they were able to, and then they're not. So we don't want to stop their disability benefits right away. We want them to be able to continue to receive them during that period of time while they're waiting. Medicare continues beyond, even when their benefits do cease for a period of time. And that's just in the case that if they find new work, or if they have, the same job, if they weren't able to secure health insurance, that Medicare continues for quite some time after. They are still, however, responsible for paying those premiums unless the state pays those premiums for them.
So, and my last question on that is there, for the compassionate care list, once that Medicare kicks in, even though that person is back to work and in remission, is there a 5-year limit time period for that Medicare benefit?
I believe it is a 5-year. I can get back to you, and I have your contact information. But yeah, and a lot of it has to do with the reason why they stopped working, and then maybe went back to work. Sometimes if it has to do with health, or if it's the same reason that they became disabled. So there's a lot of different determining factors which will determine the length that the Medicare will continue. So I can absolutely get that information to you.
Yeah, I love that.
Yeah.
A lot of patients ask about this kind of information. Obviously, I direct them to Social Security because that's my
complicated. Yeah,
it's very complicated. It's not my line of expertise, but I'd like to have like a general knowledge.
Yeah, I'd be
that's
happy
really
to,
interesting.
Yeah, I'll be happy to forward you some information that will help you, especially with those different work incentives, because there's different rules. So,
right.
Yep.
Libby, I have a question too, actually.
Sure.
Are caregivers or family members, if they're unable to work and maintain, their regular employment, if they're caring for someone at home with cancer, are they able to apply for Social Security under those circumstances, or is it patient only? How does that work?
Unfortunately for disability, only the disabled individual would be able to file that application for the disability benefits. Now, if the caretaker happens to be over the age of 62, they could absolutely look into filing for an early retirement benefit if they qualify, if their caretaking takes them away from being able to do their, what they were normally doing and earning a full-time living. But unfortunately, the disability benefits are only available to those folks who are disabled under Social Security's rules.
I have a question. The 24-month waiting period for Medicare with the SSDI.
Yeah.
So if I'm working and I have to leave my job and I'm not working, there is, I think, COBRA in some cases if you have an employer, but that I believe is good for 18 months.
Okay.
My worry is, how will I pay for insurance for my family and myself for that gap? And I mean, even COBRA is really expensive, but there's still it doesn't last, it doesn't go as far as you need it to the 24 months, it doesn't seem.
Sure. Yeah. No, that's absolutely a common frustration for people, to be very honest. Unfortunately, Social Security doesn't have any ability to assist with that. That 24-month waiting period is still a requirement no matter what. For some people, if they're not able to maintain their employment, or if they're not able to have their health insurance through work, sometimes they can go through the state of Maine to see if they would be eligible for Medicaid under other circumstances. We've referred people to see if they'd be eligible for care under the Marketplace, for Affordable Care Act insurance. But unfortunately, there's not a whole lot that Social Security can do around that 2-year Medicare waiting period.
Okay.
I've got a question. I know people have asked about, so I'm applying for disability. Do I need to get a lawyer to do that? Do I need to get a disability attorney to do that? Can you talk about that a little bit?
Absolutely. So that's a really good question. And so Social Security, we say that it's your right to have representation if that's something that you want to do. We can't endorse anyone over another just because we are a government agency. But what I will tell you is that at least the initial claim, and then even if you are denied the first time and then you apply for a reconsideration, which is that first appeal level, you don't necessarily need to have a representative. And because, to be honest, what Social Security will do is we will work with you. We can, us in the field office, our job is to try and get as much information as we can to help you send your case for a successful medical decision. We don't make the medical decisions in the field office. And so what we want to do is gather as much information as we can about your, where have you gone to seek treatment? Who have you seen that would be able to provide some medical records to substantiate your allegation? We're not going to charge you money for that. What you'll find is when you do have a representative, you often have to sign a fee agreement that they will charge you, I believe it's 25% of any retroactive benefits, or I think it's $6,200 as a cap. At the point that perhaps if you are denied twice and then you request to go to a hearing by an administrative law judge, at that point, it may be worth your while to seek representation because you're speaking with a judge. And so a judge will be able to talk to an attorney who may be well-versed in Social Security law and policy. And so, again, as I'm saying this, I'm not saying that you should or you shouldn't have one. But what I will tell you is that Social Security will not charge you a fee, and you don't necessarily need an attorney to help you do things that Social Security can help you do during your initial claim and during the reconsideration process.
And if, so the reason that I'm applying is because I have a cancer diagnosis, I'm unable to work, but I also have some other health issues. Mm-hmm. Should I be letting you know about my other health issues as well?
Sure, absolutely. Especially, what I always say is it's your claim, it's your disability claim. So if you feel that that is a condition that makes it difficult for you to maintain your employment, or it causes you to have difficulty maintaining regular employment, then absolutely, as much as you want to give us, we want to be able to obtain those medical records for your claim.
How often does the compassionate care list get updated?
I don't know that there's a set time. From periodically, we'll see press releases that come and they'll say that they've added a new diagnosis. I think the last one has come since the pandemic. I remember that they've since updated it at least once. So as they see fit, as needed, it's not a set time.
Gotcha.
All right, I want to check and see if there are any other questions. I know there's some other folks. If you need to unmute yourself to ask a question, feel free to do that. I'll give you just a second here. Okay. And we'll have time at the end too. I do know that Libby is going to need to leave the call at some point here.
5:30. Yep.
At 5:30. So just want to let folks know she's not mad or anything like that. She's just
you have to go. That's all.
So Libby, thank you very much. That
Pleasure.
Was a lot of information. That was
Pleasure.
really, really good. The next person who we're going to have speak is Tori Lavoie. She is the Financial Advocate Manager with the New England Cancer Specialists. And she's going to be addressing sort of the role of financial advocates and optimizing health insurance coverage. I will just give a shout out that I talked with somebody today who sang your praises. So I know, yeah. So pretty excited about that. Yeah, absolutely. So let me share my screen here. Figure out what I need to do.
Technology fun, right?
I know. There is. All right, let me just. I apologize here. Oh, let's see if this is going to work.
There we go.
All right.
All right. So hi, everybody. I'm Tori, Financial Advocate Manager for New England Cancer. For all sites, we have a site in Kennebunk, Topsom, Scarborough, and we just took over Portsmouth Regional Hospital, New Hampshire. So we're excited about that and helping patients down that way as well. And I'm here to kind of give an overview to see, show you what we are trying to do for our cancer patients and what is available to people that are in treatment. So common question we get, I have cancer, and typically the number one concern for patients is not the actual cancer diagnosis, but it is actually the how am I going to cover this? How am I going to afford this? What am I going to do if I'm out of work? Who do I speak to about this? And what is available to me? So the job of a financial advocate and the main goal, if you want to go to the next There we go. The main goal, and by the way, it's not just financial advocates. That's what we are called at New England Cancer Specialist. But it could be a social worker helping you. It could be a billing representative. It could be a free care representative. Many different offices, we're called, we have different titles. I refer to it as a financial advocate because that's what we are at New England Cancer Specialist. But the main goal is to limit the patient's financial obligation or responsibility. We do our best to try to find grants, help with transportation, help with mortgages, rents when people are in treatment and they find themselves out of work and waiting for a disability decision, or have no savings and still trying to work and still trying to get to treatment, 1, 2, 3 times a week sometimes, or maybe even that once a month, coming from a really rural area, and that's hard for them to handle. So that is what our main goal is to limit financial toxicity for the patient that's undergoing treatment. What is the biggest thing that we start with a patient once they're diagnosed and learn that they're going to be going into treatment? Insurance optimization and to know your benefits. So the financial advocate will do the benefit screening for the patient, do an educational talk with the patient to make sure that they know, number one, if the insurance is going to cover the treatment or not. And if they are going to cover the treatment, how is it covered? Just because it's deemed covered and medically necessary doesn't mean that there's not a $5,000 deductible or $20,000 out-of-pocket maximum. So that's what the financial advocate will do for the patient, is to investigate those benefits, relay them to the patient in a way that they can understand that, and help try to find funds to cover that deductible and that out-of-pocket for the patient without the patient having to write that check or set up a payment plan or things like that. If a patient is deemed underinsured, maybe has Medicare only or uninsured completely, the financial advocate then will help apply for main care, refer to the Affordable Care Act plan. It's a marketplace. If the patient can, possibly get a plan, depending on what the situation is, they may or may not be able to enroll outside of the enrollment period. Enrollment periods are coming up. And the 20% left by Medicare, most patients, if they don't have a supplemental plan and they're in treatment, we can get most patients free medication for their chemotherapy, depending on their income. Most patients think, I work and, I'm still employed full-time. I make, let's just say $50,000 a year, so I'm definitely not going to qualify. Many patients think that getting free medication, oral or IV, is based on DHS guidelines for like a main care coverage or something like that. That is absolutely not true. And the guidelines for income are fairly high to be able to get a grant, free drug, or copay cards. We just had a Medicare seminar at New England Cancer Specialist, well, virtually, but through New England Cancer Specialist, about the Medicare plans and what would work best for you. There are many different options out there for Medicare. You can just go with the simple traditional Medicare with a Medigap plan, or what's called a supplemental plan, and that is what we call, a really good coverage for what we see for chemotherapy medications that could range from $500 per treatment to $40,000 per treatment. We have many coming in within Medicare Advantage plans, which allot a fairly large out-of-pocket to patients every year. So we try to educate them on the insurance benefits as well, and to see what would work best for them. We're not agents, so we can't recommend, but we can tell them what we have seen in the past works best for patients. and this is what we've kind of gone over a little bit. If you're not happy with the current coverage with Medicare, what can you do? You can visit the Medicare.gov website, healthcare.gov for Affordable Care Act plans. Open enrollment is coming up for both. We are going to do another session on Medicare plans. We don't have the date yet, but we will post that on our website when that date comes up. It will probably be one at some point next week. But that open enrollment is coming up. So if you're not happy with the plan that you're currently in, those websites are both great sites to gain some information on that. Number one is to ask for help. Many, many, many times we will have a doctor come into our office and say, is there no help for whatever medication, this medication, my patient stopped taking it because they couldn't afford the copay. Never, 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 never do we want a patient to stop medication for financial reasons. I would say this past year, we've hit almost $5 million between copay assistance and free drug for just New England Cancer Specialists alone. Manufacturers are very, very generous if a patient cannot afford medication. So just because you're working full time and you think you should be able to make ends meet does not mean that you don't qualify for some sort of help. There's grants out there, like I said, that will help you meet that deductible and out of pocket without you having to pay a penny. Copay cards, there's no income limit. You can make whatever a year, you and your spouse together, and there is no income limit. And that copay card as well will help cover deductible and out of pockets. Payment plans are always, if you have bills coming in from everywhere, you know, and if you have a scan, you have the radiology reading it, you have the actual test itself, then you have your follow-up with your oncologist. Make sure you speak to somebody and say, you know what, this is overwhelming for me. What can you do for me? Is there a discount you can give me? Is there financial hardship or free care available? A payment plan? Is there anything that you can do to help us through this time? Because there's definitely help out there, and sometimes it's definitely underutilized. But if you don't, you know, have, you know, speak for yourself and have that voice, sometimes they would even not know that you're struggling with that financial piece. And there's definitely help there. So again, many assistance is available for many insured and uninsured. And for the uninsured, obviously, if you're uninsured, there's no grants that can help cover a deductible or copay, but we can do the free drug on that behalf. Uninsured are also available for to apply for the non-medical grants that we spoke about a little bit that can help with, you know, a rent, transportation, mortgage, fuel assistance, car payments, things like that that can offset your financial obligations every month to help with some medical bills that maybe we couldn't get help for some reason. The financial grants for patients in treatment are driven by diagnosis and income and insurance status. So if for some reason your diagnosis is not available for a grant, that's when the financial advocate will try to get creative to offset some of that cost so that you can free up some money that you didn't pay a mortgage with your own money this month, that we could help get funding for that through an outside organization, and that frees up some of that money for your medical bills. Other assistance, there's so much out there. Your financial assistant, your financial institution that you bank with, I'm not going to really get into that because we have representatives here for that, but just know that reach out to your financial institution. There may be a way to delay an auto loan or a personal loan or a mortgage. There may be a way to delay that. You may even have insurance on a loan that you forgot about because maybe you signed for your car or mortgage a few years ago and forgot about it, because how many times do we do that, right? And you could really use that right now while you're going through your treatment. Town office can offer some help, DHHS, utility company, all of these organizations have funds available. And the local food banks, we have partnered with the Good Shepherd. And if a patient is in need for food as well, we have food bags for patients. We have, we try to keep on hand as much as we possibly can with donations, Hannaford and gas cards, to help alleviate even that stress of patients getting to their appointments. What can I do if I'm concerned about the cost of my care? The biggest thing is talk. If you're concerned about the cost of your care, and some patients, you know, talking to the physician in the exam room, and they're intimidated. They're talking to a physician about their diagnosis. They're scared. So many things going through their minds, and the last thing they want to do is tell their physician that, you know, that treatment sounds great, but I can't afford it. Well, when we always encourage the patient when you check out, is there anybody here that I can talk to about my insurance benefits? Anybody I can talk to about, you know, what this is going to cost me? And there's always somebody in the office that should be able to speak to you, no matter where you're going to seek care. There should be somebody that can go over those benefits with you and find some sort of financial assistance for you if that's available for your diagnosis. And that's what we just talked about. So you want to talk to your care team, make sure that you speak to, you know, the free care departments, financial hardship, set up a meeting to speak to a financial counselor or a financial advocate, and make sure that all your needs are discussed so that we know the full story and to see how we can help you best.
Terrific. I'm going to stop sharing. Questions that folks have? I just want to reiterate, you know, having those conversations, and Tori, like you talked about, folks are called different things in different offices, and how important it is to find out who are those people who are in your corner, to be helpful and explore some of those different options. Really, really important. I also know there are some...
I do have a question. Tori, how does somebody get to you if someone's working through one of the New England Cancer Specialist centers? Are you automatically put in touch with someone there, or other advocates in other places? I mean, how does that connection happen?
So as soon as a new regimen is entered, or a change of regimen or a continuation, the financial advocate that's assigned to that caseload will automatically do that benefit investigation. If a patient has an out-of-pocket, I would say, of even a couple $100 or more that they are going to be responsible for, we automatically call them and touch base and try to see what we can do for them before they even start treatment. To give them that education as well anyway, to make sure, because so many times we hear, oh, no, I have insurance. And it's like, well, you definitely have insurance, but you have an enormous deductible, like a lot of the population these days. We're going to try to get that taken care of for you if we can. And if a patient, say if a patient is fully covered, a Medicare and an AARP, and they don't even have a copay, we don't usually touch base with them unless there is some sort of a need outside of, you know, medical stuff. If they mention, oh, wow, I have to come back again, the gas is killing me. I have to rob Peter to pay Paul for this oral medication. So then the nurse or whoever they're talking to will task the appropriate advocate and say, can you please touch base ASAP? Which brings me back to the Medicare plans. Sorry. One last quick thing about that is, so the Medicare plans, say if it's a Medicare and a supplemental with full coverage, that's great for IV infusions. However, if anybody's ever familiar with, your Part D plan, your prescription benefit with Medicare, that has a large out-of-pocket, so to speak, because of the donut hole. So when you fill an oral medication, if it's something at Hannaford that you get, it may not be maybe $5, $7, $10. If you're filling an oral analytic, it's probably going to be $2,800 copay your first fill, because you're going in and out of the donut hole in that first fill because of the cost of the medication. That's another time that the financial advocate is brought in. If we're doing IV treatments, that patient's covered in full. But if we're trying to fill a prescription medication and it's a Medicare, the pharmacist automatically emails the financial advocate and says, hey, listen, this copay is this much. Can you find them funding? We get them all day long, these emails all day long. So we work very, very tightly with the pharmacy in our office as well. So that's how some of the information is brought to us. And if, you know, there's been times when somebody's in the treatment room and says, you know, I have a hard time, you know, I can't even get fuel yet because, you know, things are so tight. That's another cue that the treatment room nurses will task the appropriate financial advocate and say, can you please touch base with this person?
Mm-hmm.
Thank you. Any other questions? Yes.
Do most of the cancer care places around Southern Maine offer this service? Because I tried that with where I'm getting my treatment, and I was transferred to the billing office and they offered me a payment plan, but that was about it. So what's the deal with like other providers where cancer treatment is given?
I think that each office has their own like policies and programs. I'm not sure how detailed and in depth they get. But if you have specific questions, if it's like treatment related, Maureen, are you sharing information, like our information?
Yeah, I mean, yes, we'll be sharing that out there. I also think that, you know, for each place, like Tori was talking about, there may be a different individual who works beyond what the billing department does, like a social worker. Sometimes the patient navigator would be somebody to talk with to see if they would also be helpful in that way. Tori, do you have other thoughts about that?
It would just be probably a social worker. I don't know that the programs are fully expanded in all of the other like provider offices and outpatient hospitals yet. We've just, you know, I started at New England Cancer Specialists almost 10 years ago when we've expanded the advocacy program in a very detailed way because the need is so great and patients aren't aware of all the services out there. So I'm really not sure what other places have to offer, but I'm more than happy to steer you in the right direction if that's something I can do. And Maureen can share my email address with you.
Okay.
This is also Christine. Hi, you can't see me, but you can hear me. I'm the financial navigator, social worker at Mercy as well, and I'd be happy to help if it's anything that I can assist with as well.
Yeah. Thank you, Christine.
Good to see you.
You too. And even though I don't see you, I hear you.
Any other questions for Tori? Okay. All right. So we're going to move on to our next segment here. So Nicole Lemieux is from Town and Country Federal Credit Union. She's the branch manager at the Forest Avenue location for 11 years now. She enjoys helping people navigate and meet their financial goals. She's formerly a social worker, so shout out about that. You know, that just warms my heart. And then just to Linda Halloran, who's also there. She's the community engagement manager for Town and Country Federal Credit Union and fosters collaboration with area nonprofits to address financial wellness and the needs of people in the community. Nicole is going to do her presentation.
Thank you.
Before Nicole gets going, I just want to add that, you know, we've been, Maureen and other folks at the Dempsey Center and with Tori and Libby too, you know, we've been talking for like probably at least 6 months pre-COVID. So this started, you know, back at the beginning of the year, conversations about, you know, we have people that come into our branches all the time that are dealing with a cancer diagnosis who, you know, we try to help. Dempsey Center does the same thing, New England Cancer Specialists. And so we thought, why not put our resources together to bring this kind of information to the community to try and help people ease some of the pressure and financial stresses as go through a cancer diagnosis. So Town and Country, we're very happy to be collaborating with the Dempsey Center and New England Cancer Specialists and Social Security Administration to be putting this together tonight.
Great, thank you.
Yeah.
Okay, so I am, let's see. 1 second here.
Or the Wizard of Oz, right?
Exactly, behind the scenes.
There it is. Perfect. Thank you.
Slideshow going. All right, there we go.
Thanks, Maureen. Again, my name is Nicole Lemieux. I work for Town and Country Credit Union. I am the branch manager of our Forest Avenue location in Portland. I've been there almost 11 years. One of the best parts of my job is working with people one-on-one with their families, trying to navigate through either financial obstacles or, you know, getting to their ultimate goals and dreams financially. So I'm very happy to be here. I think it's great. We've all worked so hard together, and it's wonderful to be able to do these sort of programs. So my presentation tonight is all about coping with the financial impact of a cancer diagnosis. There I am. What I'm hoping I can provide tonight is information and resources to help you manage your personal finances, whether you're the patient or a family member or a close friend. I just really want to be able to provide as much help with personal finances as possible. Thank you. So just a couple things to go over. Most people, you know, either know someone that has been impacted by cancer or, you know, possibly themselves. And we all know that cancer is expensive. So during a diagnosis, many Americans struggle to make ends meet financially. A third of people diagnosed with cancer have gone into some sort of debt. Of those people, 55% of them owe $10,000 or more. And of course, right now is a unique situation because of COVID-19. So out of that 55, 38% of those people, COVID has also impacted their finances and their ability to pay for healthcare. So there's sort of like a double whammy. We have the cancer diagnosis, but in today's world right now, we also have this pandemic that we're dealing with. Just a side, you know, percentage, 40% of Americans are not prepared for a $400 emergency. So that's anybody. A $400 emergency is pretty typical. It could be your car broke down, you need new tires, or, you know, it could be a grocery bill unexpected, and 40% of Americans do not have money set aside for an emergency. Another thing, 78% of Americans live paycheck to paycheck. So basically what that means to everyone is there's not a lot of extra money at the end of the week or end of the month for anything that could be unexpected. So the financial impact on the family goes beyond just the patient. It also impacts their family members. So it could mean a loss of income for one or more family members. Somebody might not be able to be working. So now that 2-income household has now become 1. You know, you may fall behind on bills and then start relying on credit cards. Tori hit on this, and it's great. She has a lot of resources, it sounds like, available, but a lot of times people have to choose between groceries and medication. And of course, we don't want that to ever be something somebody has to choose from. You might end up borrowing money from friends and family. Again, there's a lot of unexpected expenses. And then, of course, part of a diagnosis, I would imagine, would be a lot of like health and wellness expenses that come along with it as well. And those things all add up. When we talk about unexpected expenses, we talk about things that Tori touched on: traveling to get to appointments, gas, You know, a lot of wear and tear on vehicles. You might need a babysitter for your child, medical supplies. And then with the health and wellness expenses, that could mean, Maureen mentioned earlier, yoga, exercise, and then of course, healthy eating is also, most people know, a little bit more expensive nowadays. So it's a big impact on the family as well. So just to go over some signs of financial stress. So these would be things to sort of look out for. You know, you might not be looking at your debt. That could be a very stressful situation, especially if there's a lot of it or it's increased recently. A lot of the members that I work with in situations similar to a cancer diagnosis, they have no idea what their debt looks like right now. It's been something that you might have been avoiding for a long time. Along with not looking at debt, you could be avoiding, you know, looking at your credit score, your credit report, frequent overdrafts in a checking account, negative balances, receiving collection calls, and then of course, late payment notices coming in the mail. So these are all signs of stress financially. And then to go even further, buying everyday items with credit cards. So now the money might not be in the checking account, so I'm using my credit cards to sort of keep up with my everyday expenses. A lot of times making minimum payments on credit cards is a sign. There's not any extra money, so I'm just trying to make those minimum payments to keep my credit score where I want it to be, or to keep it so I'm not showing late payments. A lot of people will take out, you know, personal loans or payday loans. That's, you know, in a sense, you're robbing Peter to pay Paul. There's no extra money there. You might start fighting with a loved one about money. And then of course, not sleeping. So all things to look for if you're getting to that stressful time financially. So what to do? Tori said it. I'm going to say it more than once during this presentation. Don't be afraid to reach out for help. I can't reiterate that enough. I say that to members that I work with over and over. It's never too late and it's never too early to ask for help. And it's obviously better to ask for help early, but it's still really important to always ask for help. So of course that would mean in your personal finances, asking for help through your creditors or financial institutions. There's a lot of ways that financial institutions can help, restructuring debt or deferring payments. There's a lot of things we can do to get creative. So I would reiterate to contact financial institutions that you work with currently as soon as you can. I would also say reach out as soon as you're feeling or experiencing any financial stress that I mentioned in the slides previous. The moment that you're feeling any one of those is a good time to reach out. Even if you think it might be early, it's probably not. So asking for that help whenever you start to feel something stressful financially is really important. Of course, being open to discussing your financial situation is really number one. One of the things I like to talk to members that I work with about is bringing everything that you possibly can think of financially to a meeting or, you know, talking over the phone about what we can do to help. It's very important to have everything kind of laid out, the good, the bad, whatever, so that we can sort of work through it together. And that helps us be able to do these things here such as restructuring debt. So it's really important to have everything that you have financially so that we can look at ways to restructure debt. There was a member that I worked with about a year ago. She had a newly diagnosed and she had several credit cards that she was currently paying the minimum payments on. And when we looked at her situation, it really made sense to restructure her debt. So what that meant to her was we took 6 of her credit cards, that equals about $10,000. And we put them into an installment loan, similar to a personal loan or an auto loan. And we were able to cut her monthly payment in half. So it freed up half of that payment that she was making initially on the credit cards. And if anything, it just relieved a lot of stress for her, because now she had an extra $200 a month that she was able to allocate to something besides her credit cards. So restructuring debt works, and it's really helpful to just have the whole picture of financial situation when we start to look at restructuring. Tori hit on it earlier, deferring loan payments. We do that often for people just to sort of give them that couple of months relief, especially during a new diagnosis. It's also a way, it saves them that money, but it also just relieves a lot of stress in that situation. So that could be, a 3 to 4 month deferment on an auto loan, a personal loan, or any sort of loan that you might have with your institution. And then, of course, the insurance. A lot of people sign up for loan insurance when they initially take the loan out, but then, a couple years later, they don't realize that they might have signed up for it and that they've been paying for it this whole time. So something definitely to check for on any loans that you might have with your institution, to see whether or not you opted for that loan insurance in the beginning of your agreement. Financial resources, pretty similar to Tori's list, but again, these are people and places that you absolutely should reach out for as early as you can, so that we can sort of come up with a plan together for your future financial situation. So of course, number one, your financial institution. Don't be afraid to contact your financial institution. That's what we're here for. We're here to guide you in whatever financial situation you might be in. Your personal financial planner, they might have some really good ideas on possibly what to do with money that you might already have, whether it's in your retirement account or some money that you might have somewhere else that's kind of stored away. They're helpful in sort of figuring out if there's something you can do with that. Of course, your nurse navigators, medical providers, and then your health insurance providers as well. And then this is the community resources. So your town usually has a general assistance program. Definitely reach out to them. Social services such as WIC and SNAP, food pantries, housing assistance, heating programs, especially in Maine with the winter. It's a long winter and it's expensive. So heating programs are definitely key in this state, especially. And then 211 Maine is a really good resource as well. I think this has my contact information on there. That's my direct line, my email, and then our website, which a lot of great resources out there as well. But don't hesitate to email or call me directly with any questions as well.
Great. So questions? So I have a question, Nicole. Go ahead.
Is there a question for Nicole?
Go ahead.
Oh, okay. So somebody had mentioned COBRA premiums previously, and I just wanted to touch on that really quickly too, that the grants that I spoke about briefly, there's some grants out there that will help cover COBRA premiums as well for patients that are undergoing treatment or in follow-up. So I just wanted to throw that out there too, because you're right, COBRA can be very expensive. Medicare premiums for somebody that just got SSDI, even though it's, what is it, like $150 a month or something like that, $144? I don't know exactly, but right around there. That can really add up quickly too, and there are foundations that'll help with even Medicare premiums. So before I forgot about that, I wanted to throw that out there. I could go on all night, but I promise I won't.
Nicole, if you go to a financial institution, is there, like, if I want to talk about, okay, here's all my stuff and help, is there a position that I should be asking for? Do I just go to the person at the front? Who do I ask for?
Well, I think it's probably unique with individual institutions. I'm sure everybody, they all do it differently. I know at Town and Country, any of our loan officers / member service representatives are in a position to be able to do any of that sort of work. So I would probably suggest a loan officer with whatever institution that you might be a member or a customer of. I think most of the time they have somebody that's trained on how to restructure debt and do consolidation loans or whatever it might be. But I would suggest a loan officer.
The other piece of that too is the spending side. So a lot of times Nicole and other people in the member service role will, help with, with your budget, with spending, to try and figure out a way to trim costs, consolidation, refinancing, things like that, deferments, all, fall into that. But, to kind of look at your holistic financial picture at the time and to help build that bridge to get through treatment, to try and, ease some of that extra financial stress when your mind's working on trying to getting healthy again. Yeah. So both sides of it.
Questions?
I don't see anything in the chat. No.
So just a couple of other quick thoughts. There are a couple of places. Triage Cancer is a great website for anyone who's impacted by cancer. And they look at a variety of ways to help when it comes to the financial aspect. They also have a legal piece of it there and a lot of other really good information. So it's triagecancer.org is a really good place to also get some basic information, then may lead you to some more local type of thing. And then, people have talked a lot about other organizations that might be able to help. Often there are organizations that work with a specific type of cancer and they have different pots of money. So just as an example, the Leukemia Lymphoma Society will have specific grants for particular diagnoses. So often that's a place to look for some of these things. And generally speaking, the social worker, the financial advocate, the nurse navigator, whomever it is that you're working with can also help you do that. But just to mention that as another option. And then folks have talked about some of those external resources that are not necessarily cancer related, but things like LIHEAP to help with help with heating oil and things like that. If you don't have to pay for that, then you're able to use some funds in other directions. So that's another way to think about it. What are the things beyond the cancer diagnosis that I might be able to get some assistance with? And I think Nicole talked about the town offices, all of those types of locations. So really thinking outside that box. And then some of the places that we're connected with. It might be that you are connected with a place of worship and people want to do things to be helpful, but they don't know what that is. And so truthfully, you end up with a lot of lasagna in your freezer because folks don't know what else to do. So they make pans and pans of lasagna, right? Which is lovely and wonderful. But it might be that really you're having trouble coming up with the money for somebody to plow your driveway. And that would be a great place where somebody from one of those organizations could come in and be helpful. So really thinking about, what are some of those ways in which folks could be helpful to me is a way to help engage those people who want to do something, just don't know what that is. Other thoughts, other questions? So a couple different things. One is I want to let folks know that there's going to be a brief evaluation that'll be emailed to you. So it'll be a quick and easy one to do. So just want to let you know to be looking out for that. And also, if any of you would like to share your information with the presenters here, if you wanted in the chat, I'm at Dempsey Zoom 1. So if you go to the chat and you go to where everyone is, you can do a little scroll down there. And you should come up with Dempsey Zoom 1, and that's me. And just put in your name and your contact information, and I will make sure that folks are connected to that so that you're able to have conversations back and forth, and or so that the folks that are the presenters can share some additional information with you. Okay, so feel free to put that in, and we'll make sure that that happens. Okay, any other questions that folks have? If you need to unmute yourself to ask a question, feel free to do that. Okay. I want to thank our presenters. This has been just an amazing amount of information that you've shared, and it's been really terrific, really terrific. I think, thank you, Becky. I think that, you know, what we're going to try and do is see if we can post this up on our website. But if not, I will also be able to get in contact with folks about some specific information as well from our presenters. So thank you, everybody, for spending the time with us. I'm going to stay on a little bit longer in case anybody wants to add some information to the chat. Okay. And if you have any questions, or if you're not able to access that chat and you want to speak with me directly, just unmute yourself and we'll make that happen. Okay.